Hi, I'm Andy Jansons from the Alexander Jansons Foundation, and I'm sitting here with Dr. Sanjay Prasad from the Royal Brompton Hospital, and we're just having a catch-up really as to where we've got to from a foundation perspective. And just to recap, Sanjay, the original impetus behind the foundation was really a talk between you and I, trying to make a difference to research in myocarditis. The foundation would fund a full-time research fellow and a full-time nurse. Between those two, they would analyse survivors of myocarditis to find some trends that may find some solutions in the future. Perhaps you give us an update as to how our funding has helped the hospital.
From our end, it's been a really exciting time, and we're enormously grateful to the fund. We brought in a clinical research fellow, Dr. Upasana Tayal, and on the background of all the support we've had from Jansons Foundation, we've been able to leverage support for her, and in addition have been able to bring in a medical research council grant for her to enable us to do even more work. In addition, we've brought on a research nurse. Her name is Rebecca Wassel, who is really biobanking all patients with myocarditis. And this really allows us to try and track every patient we can come across with the condition.
I think the key thing from my point of view, also from the charity's point of view really, is that we funded the full-time research person initially, so now we've got some funding that's bolstered that, so our money is going now more even towards the research and nurse, which is great, and it's all growing, really.
Having that has meant that we can do more, because we now have much more funding for doing tests. We have the funding to be able to bring in Rebecca to try and track all of these patients. So it's allowed us to expand the programme.
Yes.
Is there a blood test that the point of admission that they can have as they present that's going to give the diagnosis early? So
that's a real key message in my view, actually,
that's really
to get
key.
over. Yeah, absolutely. I think from the charity perspective, the foundation perspective, if that's an outcome of our support, I think that's fantastic.
So anticipation, prevention, and hopefully improvement.
Okay, well that's a good 3 key words to sort of finish off with. Here with Rebecca, who's one of the research nurses that the foundation sponsors.
We see patients in here to recruit them for research, so
yes.
We can send the patients in here, take their blood samples, go through some questions, and do a family history as well.
Okay.
Yeah, so we do an MRI scan,
Yeah.
and we do ECG, we check their blood pressure,
Okay.
and then the blood tests as well.
Mm-hmm.
So this is an ECG machine, so it looks at the any rhythm disturbances you might have in the heart.
We're in a really small room now with a very big piece of equipment and a very small piece of equipment. It's not a great description actually, but I don't know how else to describe it. What do these do in terms of the research and analysis that you're doing on behalf of the foundation?
So this is our centrifuge, so for the bloods that we take off patients, we pop them in here, so have a look. So these spins the blood samples, and it helps us separate the bloods into serum and plasma, in which we might be looking for different biomarkers in the blood which will show as predictors.
Great, and then what about this one behind you?
So this is our freezer where we store the samples, so it's a -80 freezer, so we have to wear gloves to open it, otherwise we'll damage our hands. So put these gloves on. So this is our freezer.
Wow.
Very cold.
Yeah.
So we have alarms on them to make sure that they keep under a certain degree.
Yeah.
And then these are our samples that we put in there.
What job would you do, not what you have done, but what job would you do if you weren't a nurse?
I think probably if I hadn't have gone into nursing, I probably would have gone into teaching. I enjoy that aspect of my role at the moment with patient education. I mean, I love working in genetic research. I think it's so brilliant to be on the forefront of finding novel therapies for different patients with heart conditions and finding new ways of predicting these conditions at an early stage to stop patients having life-threatening symptoms. And the families we work with are just fantastic, you know. They've come in and they might have had something that's, you know, been very devastating to them. They might have had a member of the family that's suddenly died, or some traumatic event, and they're so strong, and they're quite inspirational. They're really positive attitudes towards research, and positive about the future, which is really great. And in particular with myocarditis, there's just so much that's still unknown, as we were talking about
that's why we're here.
Yeah, exactly.
You could be somebody else. Hang on. For a day, who would you be and why?
I probably could. It'd be good to step into the shoes of one of our patients to see how they feel coming into clinic and having, you know, all this new diagnosis going on, and being with family and really understanding a bit more of the emotions that they're going through, so that to really provide the best care.